Okay, so this is now. As you can see, there was a peak, as in many countries, in the spring into July. It went up, and this is the number fresh off the press from this morning on the Guardian. Very high increase in cases. The cases are distributed unevenly across the country with patches and hotspots. So the position of the government is to shift. Not recommendations, but the guidance in terms of what people need to do. Overall, the recommendations from universities, many employers, is to work at home if you can, and also without specific guidance or rules or laws to keep older adults in their homes. The general recommendation is to go back to being hyper-aware and very shielded in a way. I'll carry on with just showing just a snapshot. I have a few slides, a few statistics, just to give you a portrait of what's going on. So death in the UK and Wales, the numbers are for England and Wales, although we talked about the UK. What you can see in shaded grey is the average over the last 5 years of death in England and Wales, and you can see the peak in blue. These are the excess deaths for 2020, sorry. And if you look at the bottom of the figure, you could see in red that this is the death involving COVID. There's also the blue line with influenza. The reporting and the way the data is captured is a bit challenging because often infections, death involving COVID also involves pneumonia, but it gives you an idea of the peaks. If we go to the next one, where we can see by different settings that almost 3/4 of death involving COVID that occurred in the last week. So week 38 is last week. So these are numbers fresh all the way to 26th of September, were in hospital. But overall, a study by a group of researchers that involves international collaboration has told us that up to 75% of all the deaths in care facilities globally were for people with dementia, and the statistics for the UK is around 49%. So these are very shifting statistics, and some of the numbers were measured back in July. So I would expect the percentage is much higher actually, because we know that there's about 85–86% of people in care home facilities have dementia. So also the people with dementia were at high risk of COVID hospitalization was very high, and in terms of the health portrait of these individuals, they often also have a very high comorbid load. So this is not a different picture from what we see in terms of patterns of risk. As a response to that, a number of societies, the Gerontology Society and the geriatric community, have published a number of guidance to make sure that older adults at high risk are included in research and studies that involve new treatment and interventions, despite their high risk, because they really need support. But there was also a kind of social, moral, cultural, ethical backlash from a number of communities and older adults themselves in terms of the regulations and the push for shielding a lot of older adults who, just by age alone, might be seen at high risk, but they also have to balance with the other consequences of being isolated, as the previous speakers mentioned. Here, what I'm showing this is, it looks very similar to the previous slide, but what I want to highlight is that there was an increase in hospital death, increase in care home death. But if you look at the pale green line, which is the baseline, the average over 5 years, is that we are continuing to see a higher death rate for people in private homes. So something's happening. One might say, well, this is a positive because people want to die at home, people say, but I think something else is happening, and I think the challenges in getting access, or the fear of accessing some facilities and some types of services might be driving a shift in where people die because some of the needs are unmet. Now, I know there's a lot of good research coming out on it, but in 7 minutes I couldn't do it justice, so we can talk about this later. In older adults, the pattern is very similar, so I won't dwell on this, but 39% of the deaths in England and Wales were in the over 85. Now, the impact of COVID impacts on a number of these different domains, and this picture was generated in August by interesting activity by Public Health England, in which was involved, highlighting the different domains where healthy aging and efforts and research efforts need to be put into, including resilience, physical health, connectedness. So I have a little bit of data on the impact of COVID on some of these domains. Now, these are increasingly important, not just for the aging population, but as thinking about how all these spheres come together and how we can act to really influence them in a positive way. So I'll start with physical health, and I'll just zoom through this. They're just really snapshots. So there was a survey of a representative panel of about 1,000 people. It shows that overall, for people between 50 and 75, a survey is conducted in July. Overall, there was not a significant change in physical health, except in 22% of them, which is in a sense quite significant. If you look at behaviors, unhealthy habits are on the rise for cigarette, drinking alcohol, and unhealthy, but so are the good ones. People are taking the opportunity to do other things. What we don't have still in practice to guide is how do we intervene and how do we promote the physical activity with the level of evidence we have at the moment. I didn't have breakdown on how that affects the much older population, but this is still data for the 50 to 70. Mental health, as we've heard before, there's a significant impact. 36% of the 50 to 70 in that same small cross-sectional survey said they had a lot worse or little worse, and you can see the different reasons and the different drivers of why people mental health has shifted. So this is clearly a major public health priority. And just as another statistics, over 1 in 4 older workers in the UK, and that is also data from July, have been furloughed or won't be able to go back to the usual type of work, usual environment of work after or when we define the new normal. For a lot of people, there will be a completely different normal with more or less opportunities. So there's the other big sphere. I don't want to go over my time. The big sphere that to me come together is really around the meaning and the purpose and the connectedness of people. So some reports I'm familiar with, or just to say a lot of this data comes from the National Office of Statistics and some reports from other research. I'm not doing COVID specific research, so just to acknowledge the work of a lot of my colleagues in the UK working on it. This is not my specific research or the research of my team. There's a lot of information and pros and cons around the connectedness and the meaning and the purpose, which in my view come really together. So looking forward, I think, and from a research agenda and open for conversation, what I think we need to focus is to increase our efforts to assess the impact of age-friendly initiatives. We have a program of work on age friendliness. At the moment, we know very little about the short and long-term benefits, but I think the changes in communities at the moment give us a space to really rethink and maybe foster better actions to support people. One particular interest of mine is around the social return on investment. So look at the resources that go in, not just the money that goes in, and assess the social value. And it comes back to a comment from Nick earlier that we have to think about people's preferences. And when you look at social return on investment as an approach that includes older adults and stakeholders, the preferences of people of how they want their community to look like. So that can be applied to age friendliness, to dementia friendly communities, for which there's a lot of work going on across the world, but also around the technology enabled society. So the proposal is really to make a communities COVID proof with the research agenda that we can push forward. And I'll just stop by saying we have a project going on in Cambridge that look in older 75, what is their interest and their increased use, or how they interacted with technology during COVID. The results are not out there, but what we find is a lot of, as it's probably the case everywhere, a lot of people are using technology, but in terms of inequalities and the challenge we might face, it's just statistics to remind us that in the UK, over 20% of households at the beginning of 2020 still didn't have the internet. So thinking about a technology enabled, how can we use the positive shift of this, of what's happening, to understand what are the general lessons to be learned from what's happening. And also, if we put a value and then we push for technologies, making sure that the social value is actually helping and benefiting everyone, and not just the typical, sometimes more privileged and people who can access these technologies more.
Prof, that was a very interesting and exciting talk. I specifically the point around the increase or the death rate of patients with dementia seemed to be quite an interesting observation, and I'm sure the audience would have more questions around that.